Could you please put your hands together for Rosalind McKenna?
Hello, I just realised I'm quite shorter than everyone else, so I'm hoping you can see me. This also probably looks like a conspiracy because you have someone else from Glasgow speaking to you, but I promise it wasn't some kind of buy one get one free offer. I live in Dublin. First of all, I'd like to thank Brainwave for inviting me along here today. We were delighted in Amnesty to get the invitation. Part of our job as Amnesty is going out there and talking to different audiences about human rights and about the human rights as they apply to different groups of individuals. And we've done a lot of work in the last 10 years with groups in Ireland, and particularly with the health and disability sectors. In terms of who we are, I'm obviously Rosalind from Glasgow, but in terms of Amnesty, we're a worldwide voluntary movement. I think it's important, given what we were talking about earlier about the role of the voluntary sector. This is a room full of patients and service users and family members, but it's also about people volunteering to spend a Saturday talking about this issue. Amnesty is independent of any government, political persuasion or religious creed. We can't take state funding, for example, for our campaigning work, but what we're about is about the protection of human rights. In Ireland, we've got about 20,000 members of a total 2 million overall, so it's about individuals standing up for human rights. It's very much an individual-based organisation. What are human rights? Someone's waving at me, so I have to talk louder. Yes. I also will apologise, I talk fast, so tell me to slow down. What are human rights? Human rights came out of the Second World War, essentially. In 1948, having come out from those horrors, it was decided that we had to sit down and agree a set of principles about how individuals should be treated by each other and how they should be treated by their governments, and what were the restrictions upon governments. So we think about human rights like the right to fair trial, the right to be free from torture, but it also applies to things like access to healthcare. So it touches on all aspects of our lives, be they political, economic. Questions around the right to vote are as equally important as what kind of education can you access. But it's all about the complete life of dignity for an individual, and I think that's been a lot of what we've talked about today, whether it's individual treatment programs or the whole question of stigma. It's how do you care for that individual and enable them to live a fulfilled life. Where are human rights? And I'm cautious there's a lot of text on this page. The pictures of that of Eleanor Roosevelt, wife of the US president, who was seen as the mother of human rights. She was the one that really drove forward the big international treaties on human rights. And the point that she made was that human rights shouldn't be about what happens at the United Nations or about negotiations between governments, but it's about what happens to the individual person in small places close to home. It's what happens in your doctor's waiting room. It's what happens in the college you go to. And it's only with people individually taking action shall we actually deliver upon human rights protections. The key premises are very, very simple. People have rights. They can't be taken away from people. They belong to you because you are human. You don't have to qualify for human rights. Governments have duties to respect, or REPECT, as I've decided to call it, respect, protect and fulfil them. And it's set out in international human rights law. And I think this is one of the things to remember, is that governments, including Ireland, sign up to this voluntarily. No one is forcing government to offer these protections, but it's something that they choose to do. When I spoke to Helen Quinn from Brainwave, one of the pieces we were talking about is not necessarily just about human rights and human rights law, but what is known as a human rights-based approach, which is something that's come out in the past 20 years. And it's actually about how we apply human rights, because they simply shouldn't just be bits of paper that exist in legal textbooks. Essentially what we mean by a human rights-based approach is using human rights to hold people and institutions who are in power accountable for fulfilling their responsibilities. So it's about ensuring that people are not tortured, or ensuring that governments put in place a health system, for example, that actually delivers access to healthcare when people need it. I mentioned earlier we've been doing a lot of work in the past 10 years, when it's really picked up in the health and disability sectors. And one of the reasons it's picked up is that it's really about changing that shift from something being delivered out of charity or out of a sense of generosity and about someone being a problem that needs to be fixed, but rather that people are individuals who have rights, and that there are entitlements that flow from that, and that you shouldn't have to go with a begging bowl to ask for something, but that it should be delivered as a matter of right. I think it's interesting the work the Brainwave are doing around the generic prescriptions, for example, that actually that's a very concrete conversation you have to get into with government to say, hang on a sec, if you do change something like the regime for prescription drugs and the generics on that, that has an impact on individuals, and you have to take into consideration what we require. And it's about framing the person that's claiming the rights as the rights holder, and then the person on the other side of the table as the duty bearer. And instead of that always being a confrontational conversation, trying to see it as two parties coming together to come to a solution on how we deliver, whether it's the best medical treatment or the best solution in terms of how we govern ourselves as a country. Key concepts, and I apologise, someone else put this slide together and I don't know how to get it to stop doing this thing, so I'm going to put them all on the table. When we talk about human rights-based approaches, we talk about a number of different things. The link to human rights, that we actually say this comes from this international treaty that Ireland signed up to in 1973, and that it has to be applied in Ireland. That if in 1973 Ireland said everyone has access to education, then that has to be one of the things that government considers before they make cuts, for example, in education. Participation and empowerment. We had a really interesting conversation with folk earlier, and one of the big pieces is that you, the individuals in the room, are the experts on this. You know, both in terms of what the diagnosis you have, the treatment plans that you are working with, but also what are the other supports that you possibly require in order to be able to live the life that you want to live. And that you have to be involved in those conversations and in those decisions and be given the tools so that you can access those services. And that requires giving people the information about what they're entitled to and then what are the options that they might want to take advantage of. Accountability. When things go wrong, we have to have a way of saying, hang on, this isn't working. This isn't working for me to be on this treatment plan, or this isn't working for me in terms of the way that government is making decisions about generic prescriptions isn't delivering the care that we need. And having a way of complaining and saying very calmly, someone has to be accountable for this. When things go wrong, someone has to be able to stand up and explain their decision. And finally, non-discrimination. One of the pieces we talked about is that when people think of discrimination, they think perhaps of racial discrimination or they think about sexual discrimination. But it goes back to our conversation about stigma. Do we make decisions about what we assume people can or cannot do because of our own prejudices? So how do we ensure that we don't discriminate against people and we prioritise people based on their needs? Two new pieces that I wanted to draw people's attention to. The optional protocol on the International Covenant on Economic, Social and Cultural Rights, it just falls off the tongue, I swear to God. And then the Convention on the Rights of Persons with Disabilities. The first instance, the optional protocol, is one of the pieces I was talking about around accountability. It's essentially a complaints mechanism. Does anyone know whether the right to health is protected in Irish law? I'm going to suggest that no hand suggests no one thinks it is, and you're right, it's not protected anywhere in Irish law. And this is despite the fact that Ireland in the 70s signed up to say it would deliver on the right to health, including access to healthcare. So one of the pieces that has been recently created is this mechanism where an individual living in Mayo or Dublin or Wexford could write to the United Nations and say the government's not delivering on the rights that it has promised me. Ireland signed up to it earlier this year, and we're still trying to get them to actually put in place the measures that would allow some greater accountability. We all know there's big problems, for example, in terms of appeals mechanisms within the Health Service Executive. How do we actually move within our system to try and fix it over time? And a complaints mechanism would be one of the ways to try and do that. The other piece that I wanted to talk about is this new Convention on the Rights of Persons with Disabilities. It was the first human rights treaty of this century, and it was adopted back in 2006. What was really interesting about it was that it was very much pushed forward by disability advocates who were central to the writing of this treaty to say, we are the experts in disability, so we should be the experts on this treaty. So even when the treaty was being negotiated at the United Nations, things like the translations of each stage of negotiation. The first people back with the translations were those that were doing Braille translations, because they were going, this is ours, this is the one that we want to get right, so we're going to lead the field in this. And the big piece about the Convention on the Rights of Persons with Disabilities is not saying that people with disabilities should have more rights or new rights, but it's just that they have to be given the opportunity and the freedom to live their life in the same way that everyone else has a right to. What's central to the Disability Convention is 4 different values: dignity, that each individual has value; autonomy, the assumption that people can make decisions for themselves and that they have to be at the centre of those decisions; equality, that we have to give people the opportunity to access their rights regardless of individual differences; and the idea of solidarity, that we all have to put in place supports as a society to allow people to live that life of dignity and to make the decisions that they want to in order to reflect their individual choices, that decisions should not be imposed upon them. Again, someone has put together this very fancy slide, so I apologise for the clicking sound. What rights are we talking about? When I said earlier we're not talking about new rights, but what we're talking about is making rights relevant. What are the big implications around accessibility or the right to home and family? We've seen ways in which the right to marry and have children has been restricted for people with disabilities in Ireland and elsewhere. What does it mean in terms of the right to liberty? We see in Ireland still how it's relatively easy to enforce treatment on someone with mental health issues without the proper safeguards, and it's one of the things that needs to be addressed in Irish law. And the list continues with the clicking sound. And things like the right to accessible voting. Again, we've seen where people with disabilities or with particular health conditions have been prevented from accessing their right to vote in the way that everyone else is allowed to. And it continues. And sorry, pulling on that piece around right to rehabilitation, particularly when we link it to something like the right to health, that it's not about immediate medical treatment necessarily, but what are the other pieces of the puzzle that need to be put in place, whether it's some kind of counselling service or whether it's supports at home so that someone is able to live in their own home. The big piece here, Ireland signed this particular treaty back in 2006, and the big problem before Ireland can actually commit to it in full is capacity. The Irish capacity legislation is incredibly outdated and really presumes that people do not have the capacity to make decisions for themselves if there are particular health conditions and in particular mental health conditions at play. What's critical is that people's capacity is not undermined by those mental health conditions or physical health conditions, but that they're allowed to make decisions on an equal basis, and that the legal capacity is there so that individuals' rights to make decisions are then reflected in the way that those decisions are actually taken, that decisions are not imposed upon people. Oh, that's the wrong place. Amnesty has been working over the last year with a number of organisations, including Age Action, including Shine, including the Centre for Disability for Law and Policy, on what the new Irish capacity legislation should look like. We should presume that people have the capability to make decisions and then support them to do that. We were hearing earlier from John Paul talking about stigma and how there's an assumption out there that for whatever reason someone cannot make that decision themselves, or to do so they would make the wrong decision. So instead of just assuming that someone can't make the decision, what are the supports that need to be put in place? What's the information that we need to give to that person? What are the ways that we can support them, either in a family setting or a community setting or a medical setting, to make a decision? But that people have a right to make their own choices, and then for the supports to be provided for by the state. And that if we are going to take away someone's rights, we were talking earlier about the question of health and safety, if we're going to take away someone's rights for whatever reason, then we have to make sure that there are safeguards in place so that we can review that over time. We don't make a decision that says this person can't do something and they're never allowed to reverse that decision. We have a system in Ireland on the wards of court, and if you're made a ward of court in Ireland and the decision to make decisions about your life is taken away from you, you can't get it back. There's no way to reverse that decision. We have very, very old legislation. So what Amnesty and others are looking at is, if we say as a starting point that people have human rights, that people have those human rights equally, regardless of their health condition, how do we support people to live that full life? And whether it's about ensuring that the right medical treatment's in place or ensuring that the law doesn't prevent people from driving or from having a family or for getting married, then we need to make sure the safeguards are there. Human rights is never going to be the overnight solution. It's not going to deal with a lot of the questions that are being addressed around the room in terms of education services or even some of the nursing appointments upstairs in terms of more immediate health needs. But it provides a framework for how we have a conversation with government to say, these are the services that you have to put in place. We have a right to these services. To have a conversation with doctors and nurses and those involved in our care to say, these are the ways that I would like to be treated and these are the ways that I would like you to take my opinion into consideration. Human rights are a tool that are being used by lots of organisations across Ireland, and it's one of the ways that we would encourage people to think about it, that you're not asking for charity, you're simply asking for human rights. And I will stop there. Thank you.